Wow, I'm really excited to see you all here tonight. Thank you for coming. I'm Ruth Schaefer. I'm the community librarian here in Mount Salmon. But I have the opportunity to work closely with the Friends of the Library, and then there's a subcommittee of the Friends of the Library that work very hard every year to put together our community reads. And I've been asked to introduce you all, so if I could just get the committee to stand up for a sec real quick. Great. Here they are. Kim Michaels, Kim Payne something. What's the last name? There you go. Janet Holland, Beth Parkenreiter, and Rhea Fiddler. Correct. All right. This is the team of people who work all year long to get the community reads going. I'm going to assume you all had a copy of the book. We gave out 100 copies of Remarkably Bright Creatures. Couldn't get one. Thank you. If you're done with it and you don't think you're going to read it again, please bring it back because we have people that really want them. We would have loved to have more than 100. We probably could have done 150, but we just didn't. The book didn't come out in paperback. We had to get it in hardback. It was supposed to come out in paperback in time for this, but then the publisher changed the date. There's always the stories of why. Anyway, Remarkably Bright Creatures is a debut novel by Shelby Van Pelt, and some of you may have had the opportunity to listen to Shelby last week. She joined us from Chicago via Zoom and gave us just a delightful insight into how she created this fabulous book. I also want to talk about the art show that's in this room. All of these paintings, pictures, drawings, quilts, whatevers, octopuses. It is octopuses, by the way, not octopi. All of this art was inspired by the book, and this idea came to us from Mary Kopp, who's not with us in the room tonight, but she started this program, and the art is just an amazing thing that comes along with the program. We do ask you to vote for your favorite art piece. Back on the piano is a box and some little pieces. Well, you can only vote once, Diane.
Maybe you could have categories like most creative or most pretty.
No, join the committee. Next year we'll do that. Watch what you suggest in the committee. I also just want to point out back on the piano is the Friends of the Library brochure. If you want to get involved with the library, this is really the best way to help the White Salmon Library is to join the Friends, help the book sale, the wassail, the ice cream social, the community reads, which we were calling Kuduga, but we changed it over to community reads, but we sometimes use those words interchangeably. And lastly, I just want to point out that we do have a full brochure with all the information about the programs we're doing. Coming up after tonight, we'll have, at the end of October, we'll have 4 sessions of Tai Chi with Janet Esley, Tai Chi for seniors right here. Next week, we'll have someone zooming in from Alaska for us, a woman named Marley Luna. She's an expert in giant Pacific octopuses. She's raised and released them, so she'll be joining us via Zoom. And then on the last Thursday in October, we will be showing the film, My Octopus Teacher. If you haven't seen it yet, join us. We'll be showing it here.
Or watch it again.
Or watch it again. If you can't make it, it is available on Netflix, but they'll compete with me, so come here, watch it with us, we'll make popcorn. And that's really all I want. Oh, and actually tomorrow, if you have a child, tomorrow we're doing something called Kuduga Junior, and we'll be running a children's program where they'll be doing an octopus extravaganza. We're super excited to have done this book and have the opportunity to do all these programs. But you didn't come here to listen to me chat.
No, you were Sharon doing the Tai Chi?
On October 18th and 20th, and then the following week, I think it's the 25th. It's 2 Thursdays and 2 Fridays. 2 Thursdays, 2 Fridays, the last 2 weeks in October, she'll be doing Tai Chi. She's been doing Tai Chi for over 40 years. And she's super excited. She's been talking to me about octopus Tai Chi for months. I'll be there. I'll try to be there. But I really want to introduce tonight. Tonight's pretty exciting to me. If any of you had the opportunity to see the play Ripcord when it was down at Binging Theater, it's about an assisted living, which is sort of central to one of the themes in this book, as is aging. Right now, I learned that Sharon is the director of Senior Services with Klickitat County. I've known her for a couple of years, didn't know her title. Thank you for coming and speaking with us tonight. She has brought some information that's on the back table there, but I'm going to get out of the way and let her talk, and she'll tell you what's out there. But please listen carefully. You'll learn a lot.
Hi, so now everybody's waiting for the results of this bat, and I'm supposed to be entertaining in the meantime, so that's kind of rough, but. Anyway, I was asked to come and talk about, well, aging in the Gorge, but also in terms of just talking about aging in Klickitat County would be more my specialty right now because I'm the Director of Senior Services. I've been that for 16 years now. It's time flies, it seems, but we are actually part of Klickitat County government. We're a special fund within Klickitat County. That special fund means that we're not supported from the general fund dollars to run county government. My department, I should say, in terms of senior services is grant funded. We do receive support from the county in our office space, kind of utilities and that. We have an office here in White Salmon at the Pioneer Center. And in Goldendale, we have an office in the new county services building that was built, the administrative building there. We're on the first floor there. And so the county provides office space, utilities, and then they also do provide some cash support out of solid waste revenues. And that cash support provides match to the grants that I should say, apply for to provide services for seniors within Klickitat County. So we are part of the Area Agency on Aging and Disabilities of Southwest Washington, which is a mouthful. But the state of Washington has actually 13 area agencies on aging. And those area agencies on aging receive funds from the federal government, from the Older Americans Act, that many people have probably seen in terms of communication about writing to your Congress people about the importance of Older Americans Act funding. And so that's the federal funding we get, and we do also receive some state fundings, and then we receive support from other private charity grants. United Way of the Columbia River Gorge provides some support for us each year. And I look for a variety of different grants and programs that we can try to bring to our community here. We also have a lot of support and grants from the Washington State Department of Transportation, and that also has varied sometimes with federal transportation funds to support programs and services here. So part of the key piece of the Older Americans Act and services specifically for seniors, and senior is a pretty broad, I mean, it keeps getting younger, it seems like, because, you know, anybody that gets the ARP notices and that, it's like, okay, it was 60, then it's 50. I think next it's going to be 40 and 30 that remembers, but there's a lot of good information that we get from those organizations, I think at any age and in terms of planning ahead for our future. But for our purposes, the usual designation for senior is 60 and older. That has been what's outlined in the Older Americans Act, but there are different programs and services and grants that have different age brackets within there. And then many you'll know too with Medicare eligibility is 65 or with disability. So there's a whole lot of different age qualifications as well as those brackets. And that's some of what can be challenging is for people to know, oh, you know, can I actually access senior services? And so one of the things I want to emphasize is that senior services, though, isn't just really for seniors. It's kind of a misnomer. It's really the support and services that we're providing are for seniors 60 and older, but also for folks that are adults with disabilities or friends, family, friends, loved ones of maybe an older person or a disabled person that's needing some assistance and needs some guidance on how to provide that support and intervention and services. So one of the biggest areas, I guess, in terms of support and service that my department provides and staff in my department through some of that funding with Older Americans Act, and then that support with the county is just what we call aging and disability resource services and information and assistance. And it's a mouthful to say, but basically it's like if there's any issue or concern or question, we encourage you to call us and kind of describe or explain or express the situation. And sometimes it can be as simple as, I need the phone number for my local utility company. I need to know where I can get internet service, who those resources are, to more complicated things that are like, I am a person that is caring for my spouse who just has been diagnosed with dementia, and we need to know what may be coming, what are some of the information and resources and services that we can access, as well as what are some of the specialists or connections that you can make for us. So there are times that there's service that we provide directly at Senior Services. Many times though, it's also connecting people to other resources and other specialists that are either local or regional or statewide. We are an access point for helping people to apply for services that may be available through state funded programs, federally funded programs, individual other types of supports. And the challenge is there's really a lot of varied programs and services that again have different qualifying criteria, and so it's really hard to get that information out in general. And so a lot of times the easiest thing is for, again, somebody to call us and kind of describe the situation you're in and just say, hey, I'm looking for what are some of the things that are available to me. And not always just something in terms of somebody having a disability or a care need or dependency. It can also be, hey, I'm a really active senior member of the community. I'm retired or I'm working for, and I'm really wanting to help out and I want to find other people and things to engage in. We always have volunteer opportunities. And really the way we're able to really carry out a number of programs we have is because we have volunteers that help make that happen. And so some of the services outside of just information and assistance and referral service is nutrition programs. So we do get funding, again, federal and state funding to provide nutrition programs for seniors in Klickitat County. And so that's part of, and I have out on the table just our, come join us for lunch. We have a noon lunch hot meal at the Pioneer Center, Senior Center on Mondays and Wednesdays here in White Salmon. It's on Tuesdays at noon in Lyle at the Lyle Lions, and then in Goldendale, Tuesdays and Thursdays at noon at the Goldendale Senior Center. And that's an opportunity, again, for people, one, to receive nutrition that's a well-balanced meal, and more is to engage and socialize with other people. At the White Salmon Senior Center here, one of the popular things is live music and dancing. And so in addition to that, at our different, the different centers, and here at the Pioneer Center, we have some different volunteers that provide strong people class that's really well attended and very engaging right now going on and during the week. We also have we have a local psychologist who's actually comes once a month and has a session called Just Let's Talk, where people can come and kind of share anything that they may be having challenges with. We've had also another end-of-life doula who was providing grief support group, trying to look at a very number of different programs and services to engage folks. And again, we're always looking for volunteers and folks interested in participating in that. And some of that funding that we receive, and in terms of grants that we've applied for, we have a chronic disease self-management program that's been being offered throughout the year, and that's been via Zoom. So we've been learning, again, some of the things with COVID to access other ways, but some of the benefits of that, it's allowed people throughout the county to access and engage in some of those programs, especially during the winter months when it can be challenging to get around, the gorge. So in addition to our meal site locations, we have Meals on Wheels or home delivered meals available. So we do have hot meals that can be delivered on our hot meal site days, or frozen meals for folks that are homebound and needing that service. And that can be available throughout Klickitat County as well. One thing too I want to bring up, because starting Monday is open enrollment for Medicare. And that's when anybody that doesn't know Jill Parrott at our office here in White Salmon, or Doreen Eckes up in our office in Goldendale, there are staff that actually participate in very detailed and ongoing training with the Office of the Insurance Commissioner, that State Health Insurance Benefits Advisor training. And they are able to help people navigate and during open enrollment, look at what your options are for Medicare prescription drug plan, Part D, because those plans change every year. And those changes could result sometimes in thousands of dollars in savings for you if you're making sure to look at those every year. Sometimes you don't need to change. That stuff also helps people to navigate just even aging into Medicare. What's happening even while people still are employed, but becoming Medicare eligible, what kind of makes sense. And they're independent advisors. They don't work for insurance companies. They work for senior services. They're just there to provide the information on the different plans and give that out, that's unbiased information for folks to be able to make choices and decisions on that. And that open enrollment runs from October 15th to December 7th. Every year. So we do have people calling and making appointments for that one-on-one counseling sessions with staff. Additionally, under our Older Americans Act and funding and services that we have and grants with Washington State Department of Transportation, there is transportation service available. And the transportation isn't just for seniors. It was originally started in I think in the early 80s, it started with a senior van. There was a wheelchair van, a really ugly brown van, but what looked beautiful because it was the first transportation that was available. And it was originally just for seniors, to help seniors get to like meal sites, appointments and that. And that has actually grown in time to become a fleet of 18 vehicles that serves not only seniors, but the general public, and that the focus is on seniors and folks with disability. We have expanded from a dial-a-ride service, which we continue to provide and have provided, where people can call and get a trip from their home, somebody to pick them up at their home and taken to a medical appointment or another essential trip thing to like the grocery store, and back again, dropped off at home. We have added additional service in 2018. We were able to add fixed route public transit shuttles. We have the bus that runs shuttle runs between White Salmon, Bingen, and Hood River, Monday through Friday from 7 to 7, and that anybody gets on at any of the stops, and it connects with the transportation over with Cat and Hood River, and then Muscomani County. So that service started in 2018 and continues to expand, and we have also a fixed route that runs between Goldendale and the Dalles also. So part of us being able to access some of those grants and service allows for us to provide much more transportation for seniors. We're providing about 650 trips a month for seniors in Klickitat County, and that's to get to, and our service area is not just Klickitat County, because as everybody that lives here knows that many specialists and a lot of the providers aren't here in Klickitat County. You have to go to Hood River, the Dalles, Portland, Vancouver, and then on the eastern part of the county, many people end up going to Yakima or Tri-Cities for specialists. And so we do travel that whole area for folks to be able to access those specialized services, and obviously the VA Medical Center is a big one too. So that's a service that's available. Again, it's not just for seniors, but we do have the benefit for seniors is that those rides that are provided for them for medical is just a suggested donation. There's no set fare cost that's associated with that. It's subsidized through funding that we get from Older Americans Act funds from the state and federal government. So, so outside of transportation and nutrition, information and assistance, and then we also have we do have staff that are provide what we call case management services, and they're more specialists in helping folks that are residing in their homes and needing in-home care and services. And they're on some programs, you know, with the state, or are needing some guidance on how to access some of the programs and services that are supported through some of the state-funded programs. And there are social workers that help to provide assessments and guidance and explain to people about what their options are for long-term care and help them find those supports and services if needed. And that's provided for folks throughout the county as well. And then additionally, we have our senior newsletter, and there's some samples on the table. And people can get on a mailing list. If you want a hard copy mailed, we have that, and it's also posted on the Senior Services website. It gets uploaded every month. And that newsletter, we try to get as much information out about a number of varying issues, but programs and services and supports that are of benefit to seniors. So right now, a lot of what it is about Medicare open enrollment. We also have, we partner with the PUD in processing applications for the senior PUD electric discount, and partnering with Washington Gorge Action Programs with low-income energy assistance, and then just information about, I think like in this month, there's even a study that folks can participate in that relate to caregivers, and it's a study with MIT and looking at some robotic support for socialization. So, and there's different times that we get information for studies or programs and things that are available through the Alzheimer's Association. The other is, you know, like senior property tax exemption, any way that we can try to help people save money, access services. That information we try to get out in our newsletter each month. And so, and then we also have equipment lending. We do get walkers, wheelchairs, any range of types of equipment that get donated to our organization that's available for people to come and get for their use, so they don't have to go purchase it and spend the money on that. We have, and it kind of ebbs and flows with what we have. Sometimes we're overloaded with things, and the next time we don't have much, but we encourage people to either donate equipment to us and or come and check out what we have to be able to access. And I feel like I'm rambling now, so I don't know if anybody has any questions. Oh.
When I was, you know, you put everything into perspective, and I think you soup to nuts, but it kind of like, when you set this up, like, I mean, it just really occurred to me that, so your boss is the county commissioners. They're not funding you. So why are they your bosses? And all the funding sounds like it comes from elsewhere.
Yeah.
Except for the attorney on the loans.
Well, and we're unique. I would say Klickitat County you know, this is what's the challenge is the supports and services for seniors, even though there are 13 area agencies on aging throughout the state, and they're then regionalized. And so the region that we're part of is the counties of Clark, Klickitat, Skamania, Wahkiakum, and Cowlitz counties, those 5 counties. And so they have their funding branch. And then, you know, those aren't all county governments that have, you know, the only actual county within that region that actually has a senior services department is Skamania County. It's actually fairly rare. There are different models where sometimes there's individual cities that have services, other times it's other nonprofits in that. And it kind of became part of Klickitat County taking that on as a government entity is because there weren't other people responding to that. And that's kind of in other areas, like in Clark County, they have a lot of different types of providers that provide those different senior type services, where I think we benefit with it being part of the county or under that umbrella and being a department is we do kind of have, it's almost a one-stop shop versus it being very piecemealed out. The challenge is that it does go back to sometimes with the commissioners where they're like, okay, there aren't other counties doing this, so why are we the ones paying for this, you know? And so they are providing cash support, but they're not fully funding, you know, they're providing more of the match and that support, but there's other counties that aren't providing anything for senior programs. So it really varies. There's not a really set model.
You forgot the pool table.
Oh, what, right, yeah, there's a great pool table that gets a lot of use over at the Pioneer Center here. So anybody interested in shooting pool, playing pool, and I forgot a really key piece too, is so the county commissioners are my boss entity that I answer to, and they are the ones that hired me and are my bosses. But they did form some time ago when they made the senior services department. They have an advisory board. You know, there are a number of advisory boards within the county, like there's the Water Conservancy Board, there's different boards. The senior advisory board is one of those boards, and that consists right now, the advisory board is 9 members. We actually are down members right now, so but it's to consist of at least 9 members, and they are to be representing the 3 different commissioner districts. The preference is to try and have equal, but at least 2 from each district was what the preference was. We currently have our White Salmon district, our District 1, which is White Salmon, Bingen, part of Trout Lake, and you know, it kind of got reconfigured in between. There's representation, because I think actually, and then District 2, which includes like Lyle, Dalesport, Glenwood, and then District 3 is more Goldendale, Roosevelt, eastern part. So currently we're down members for District 3 for our senior advisory board. And that advisory board the requirement is that at least 51% of advisory board members be seniors, 60 and older. And then it can be not all seniors, as long as they're trying to represent the interests of seniors. And Shelley is one of our senior advisory board members.
I seem not to know
And
enough.
Ruth.
I don't know enough. So I remember specifically one of the commissioners, when we were talking about the issue of the assisted living, one of the commissioners, no names necessary, said that's not the purview of the county to do it. And so we're not worried. Basically, he was saying we're not worried about it. So it makes me think, because the advisory board doesn't tell the county commissioners what to do.
No,
But there must be is there any state laws that relate to seniors that they should be doing?
there's nothing in terms of the state that dictates like the county or whoever that cares. I mean, the state does have what they dictate the area agency on aging, because the area agency on agings, because there's 13 of them in the state that are made up of different regions, they do have guidance on what they need to have carried out with the funding they're getting. And then that's Older Americans Act funds that come in, and then we've been willing to contract and provide the services within Klickitat County, but it could be any entity that did that.
I really appreciate this. This is very informative. Thank you for your time.
Thank you.
And you briefly mentioned Veterans Affairs. So is it transportation, or do you offer broader contact?
So, well, in veterans, there is a veteran service officer that is on staff with Klickitat County. So they're actually, that veteran service officer is an employee within the auditor's office, which seems kind of interesting. But Frank Duncan is the veteran service officer for Klickitat County, and he has 2 days a week that he has an office at the Pioneer Center. It's like right when you come in, if you were coming in the main entrance, where there's a little reception desk there, his office is right in there. And then he's 2 days a week up in Goldendale in the courthouse, but I think they're looking at something in his office up there. But he is staffed 4 days a week with Klickitat County, and the information for him, I'm happy to provide that if anybody calls our office, or it is on the klickitatcounty.org website. In the auditor's office, there's actually a click for veteran service officer. But veterans that are seniors or disabled could also potentially access different programs and services through our department in senior services. Because we also help people apply for long-term care services through the state. There's different qualifications in that. We help screen people for that, and we can actually help with that application. A lot of the state programs and services, there's online applications and kind of hoops to jump through, and we can help people walk through that. Jill with our office, as well as Christy, who's one of our case managers, they can help people just even understand and navigate through paperwork they're receiving. Like when anybody that has, Medicare or is aging into Medicare, you get so many mailings and so many things that you don't even know. Is this real? Is this fake? I don't understand this. Please feel free to come into our office, to call and make an appointment and navigate through those and look, because we can help check and see because the scammers, unfortunately, are extremely savvy. And there's also just a lot of marketing we're getting bombarded with, because there's also now Medicare Advantage plans haven't typically been available in Klickitat County. They now are. The problem is as much as they make them sound wonderful, people will enroll saying, oh, they said they're going to give me this card and I get this money I can spend each month to buy some extra things. And they told me, yeah, all my providers are on. No, your providers aren't contracted. They have told people, yes, your providers are. You have to make sure and check with your provider and say, do you accept Molina? Do you accept this plan? And find out, because we're having a lot of stressed people. It's, calling and in crisis because they've enrolled in a plan that they can't get any of their services with. They can't. And then there's times that you can't change that again until an open enrollment cycle. And so it can cause a tremendous amount of stress. And so we just encourage people to, reach out to us, call us. We answer the phone. We don't have a telephone tree. I will say that there is the possibility that you could get voicemail. There are times that we are all on the phones and busy, or we have, a day that we don't have everybody at the office, but we don't have the telephone tree that you have to press and then figure out. I mean, what we have, if you leave a message and give that, then we'll reach out and say, okay, what is it you needed? And then we can try to direct you to the right person, because that's where we get a lot of folks that it's just, there's so many things that they're getting telephone trees or not, and they're like, I don't even know who or what question I'm supposed to ask. This is my problem. And so, you know, again, it may be something that we don't have an immediate answer for, or we can't solve right away, but we definitely will research and try to find that service and support. And, you know, one of our biggest challenges right now is we have a lot of people looking for resources for home care, you know, just providing some support at home, a little bit of help, and there's a shortage. There's a workforce shortage in providing that caregiving, and we know there are people that would qualify to help, you know, get that help and service, but there's no providers with the agencies. So that's a bit where we're having kind of that struggle, and we're definitely advocating and trying to get more of those support and services for our area, because again, you know, and Shelley had brought up, you know, assisted living, you know, one of the big barriers we have, you know, as much as it is that most people are able to stay home and most people prefer to stay home, there are times that someone does need to go into a facility with 24-hour care. And the sad thing is here, there isn't anything in Klickitat County. I mean, there's a couple of adult family homes, but they typically are full. And if you need assisted living or a nursing facility or more, you have to leave Klickitat County. And if you're on Washington Medicaid, the state assistance, because typically, I mean, it's not cheap to pay for care either. You aren't able to go into an Oregon facility. So somebody's saying, oh, I could just go to Hood River or the Dalles. There's no reciprocal agreement. That ended a number of years back. So we have folks that have to then, the closest they can go is in Vancouver or Yakima. And so they're having to leave their home community. And so, you know, that is one of the areas that I know the advisory board has been vocal about and trying to push is you know, and it's getting that funding to have some more options for folks. But the other is that development of workforce and providing that service. But there, again, we can help folks look at what some of their options are, also to understand what is paid or not paid for, because a lot of people think, oh, Medicare is going to cover it. No, Medicare is very defined on what it's going to cover. And we can kind of help and look at some different programs and services. But it's a hard thing to spell out in writing. There's, oh, it's this and this, because there's so many different variables and situations. And so,
there's times when, so for example, it came up in Strong People the other day about does Medicare pay for RSV, for example? Would your office know that, or would we have to call the health department?
Oh, if they pay for the vaccine?
Yeah.
Well, and so that would be something that we would typically know or look up.
You can look it up.
Yes, yeah, we would be able to look.
They do, by the way.
And well, and that's the thing, is there are things that are covered, and it depends, you know, because they're different. You've got Medicare A, Medicare B, Medicare D, Medicare C. So there are some things that are covered. If you have Medicare B, which is typically your medical provider code, you know, A is more of your hospital benefit, B is more of your medical providers, but it's also durable medical equipment, and then there's certain medications even and services in that and vaccinations that are covered under B, but then other ones that have to be obtained through your Part D prescription drug plan. So that's where they can't make it simple, you know.
But you can find out, because
we would be able to find out, yes.
Setting, somebody said it wasn't covered, and that's why they weren't gonna get it. And then, it turns out it is covered.
But it's right, and then it would depend
It wasn't part
if they
D.
have,
No, it
yes.
wasn't Part D.
but if they have B, there are people sometimes that haven't gotten their A or B. So there's penalties for delayed enrollment and different things. There's a lot of those different, so everybody's scenario could be different. And so it has gotten, it seems like more and more complicated too, and then you get mailings from everybody under the sun and phone calls and TV commercials, and it makes it even more confusing. So there are things, though, on the positive side of things, there are some things that they are looking at being available through some of these, and potentially if some of the managed care develops better with more providers, as some of those are looking at providing and partnering to do meals and other supports, because they're finding, hey, if we can help people stay healthy, it costs us less money if they're not in the emergency room in the hospital. So we'll fork out some money to help with meals so there's some pros to some of those things, but it is a big thing to navigate, and that's why we have staff that participate in trainings and go through, but they don't always know the answer right off the top of their head either. And I don't want them to answer and tell somebody something without making sure. So there are times that we'll say, okay, we need to get back to you and we'll get some more information to you. But Bruce.
Yeah, thank you. 2 questions, quick ones. Your transportation service, what days of the week does it operate?
So we primarily are Monday through Friday. We do make some exceptions for some special medical circumstances on our dial-a-ride, and that's for dialysis patients. Currently, we don't have anybody on a weekend, but that has varied. It was actually pretty common for us to have Saturday dialysis transports.
Okay.
Or we also have had some disability determination ones that seem strange that they were doing them on a Saturday, but we do make that's kind of by special arrangement. We have done weekend, but typically it's Monday through Friday. Our primary 7 to 7 is our operating hours, but we do actually operate before and after then, again, for special circumstances, because anybody's have surgery, they want you there at 5 a.m. So we have drivers going out to Glenwood and picking somebody up at 3 o'clock in the morning and getting them into. So because you don't have that choice really with surgeries, we do ask when people have like regular appointments that they try to book them, especially when they're in, especially coming from Goldendale and that to Portland, just one way, that's like 3 hours. So, and we do use volunteer drivers. We only have a couple right now. We have in the past had more, the pandemic really kind of impacted that. And so people that are still ambulatory and able to ride in a regular car, we have volunteers, but all of our drivers are background check, FBI, also they have actual driver training, they have the employer driver record checks, they have to have a very clean driving history. So.
And my second question was, when you mentioned case management,
yes,
with your home care social workers, I just wanted to know, are those workers in collaboration with WAGAP's community health workers?
Yes.
Okay. Because that would be a pretty strong mutual benefit.
Yes, yeah. So Washington Gorge Action Programs has community health workers that work with individuals, and they do collaborate, and that is very much a really good partnership that's been able to happen with our case managers and the community health workers. And then there's other health home care coordinators that are under another, there's a lot of the different, and then on the Oregon side, CCOs that often will communicate, but
thank you.
yes, yeah.
Clarification, the driver that took me to an appointment stated that she was paid.
Most of our drivers are paid.
But it said they're volunteers.
No, I said we do also use volunteers.
Also, okay.
Yeah, no, we currently just have 2 volunteers, one in Goldendale, one here in White Salmon. But we do, the majority of our drivers are with Mount Adams are paid. They would drive a Mount Adams vehicle, one of the minivans or the mini buses. But we have a couple of people, if you've seen, Carl is one of our drivers that does more of the White Salmon. He has like a blue car, and he has there's one of those magnetic signs that say Mount Adams. So just in the event, if somebody doesn't need wheelchair accessible transportation too, we do sometimes have a volunteer that will take them, especially for the Portland type rides, because that is definitely saves a lot of money in terms of having a volunteer provide that service versus a paid driver. But and all of our paid drivers have special passenger assistance training, and they get that on an ongoing basis too. But we have full-time, part-time, and then casual, which are kind of our part-time and full-time drivers.
Wow.
So,
Wow,
Nice.
amazing.
Yeah.
Wonderful.
and they're very, very caring people. I mean, they're